Health leaders are urging people to get their flu shots.
Multiple organizations, including Baptist Health, are holding free vaccine clinics over the next few days. Lucy Bryson is live in Georgetown, where the first clinic will be today. Lucy, why now?
Well, Victor and Destiny, Baptist Health tells us that October is the optimum month for you to get a flu shot. And with today being day 1 of October, very hard to believe that I'm saying that. It's really time to start thinking about where you're going to be getting that flu shot. That's why Baptist Health and some other Lexington organizations are hosting shot clinics throughout central Kentucky. They're going to be happening in Georgetown, where I am right now. They're going to be happening in Frankfort and in Lexington over this week and next week. We're going to tell you exactly where to get those shots. We've got the times, locations, and dates for all the clinics coming up on your screen right now. Today's shot clinic is at God's Pantry, where I'm standing now. It's to give shots to those who are collecting food at the pantry this morning, but for everyone else in Georgetown as well. Thursday is the Lexington-Fayette County Health Department's clinic in Lexington. Next week, the state capitol is hosting a shot clinic, and God's Pantry will give you 2 opportunities to visit next week. Sources say that many people are opting out of the flu shot as of right now. A recent study from the National Foundation for Infectious Diseases says that 2/3 of adults admit that getting the shot is the best way to prevent the flu, but 45% of those people don't plan on getting vaccinated this season. This statistic also comes as NFID findings highlight the need for greater awareness for respiratory diseases, as well as the safety and benefit of vaccines. Now, for all these clinics, there is no registration needed. You can just show up and get a shot. And they want to make sure that you are getting that shot ahead of that flu season. For now, live in Georgetown, I'm Lucy Bryson, WKYT.